Welcome back. Time again to answer your questions about COVID-19. And with us this evening, Dr. Michael Curry, an emergency room doctor at Delta Hospital just outside Vancouver. And Dr. Curry, first question, and I know we've had versions of this question before, but we keep getting it. So let me ask you, is it okay to allow other families to use our swimming pool while we're not using it?
It should be. We know the COVID virus is primarily spread by contact and by airborne particles. So as long as people haven't been using the pool immediately beforehand, and as long as common surfaces are washed down, and chlorinated pool water would be an ideal substance to do that with, there should be little to low risk of COVID being transmitted through a swimming pool that's shared, as long as people are physically distanced and surfaces are cleaned.
All right, so that was a relatively simple issue. Let's go on to one that's a bit more complicated, and here's the question. Dr. Bonnie Henry says every pandemic has a second wave, so we should expect one. And by the way, of course, she's the Chief Medical Health Officer here in Vancouver. But in terms of timing and magnitude, what does that second wave mean?
So what a second wave means is that the factors that allowed the germ that causes COVID-19 to propagate, the fact that it's infectious and the fact that people can spread it when they don't know they're symptomatic, means that, or before they know they're symptomatic, means that this virus is not gone. We still have COVID-19 circulating in the community, but at a lower level. So as our safeguards sort of relax a little bit, we can expect a second wave. And that's what happened with the flu pandemic of 1918, where it actually seemed to go away in the summer, but then it came back worse the preceding fall season. We're hoping that doesn't happen with COVID-19, but there almost certainly will be an uptick to some extent in the amount of COVID cases we see as we relax restrictions.
So just to clarify, I know that certainly in Toronto this weekend, but even in Vancouver, there's talk about how slow reopening or people getting together in parks, that sort of thing, could lead to an increase in the number of known infections. But in terms of a second wave, you're talking about something bigger and further in the future.
That's right. So there will be an uptick as things go up, but what we're trying to do is trying to control the rate of opening so this uptick becomes a manageable uptick and it doesn't become a second wave where we end up with our healthcare resources being overwhelmed.
Okay, we have time for a quick answer on this third question. When someone invades your space as you move, would it be helpful to hold your breath?
You know, it might be marginally beneficial, but unless somebody's breathing right in your face or speaking moistly right at you, that's unlikely to spread the virus. It's really the common touch and common surfaces. So washing your hands is probably the best thing you can do. Although if you really want to hold your breath, if somebody comes within 2 meters of you, it probably won't hurt.
Full disclosure, I was smiling during that question because I sometimes do hold my breath when I feel somebody is too close. Anyway, Dr. Michael Curry.
I do as well, Ian.
Always nice talking to you. Thanks.
Thank you, Ian.
And of course, we're asking your questions about COVID-19 each night, and you can send those to us, messaging us directly on Instagram at CBC The National, or send us an email, covid@cbc.ca.